Spinal cord stimulation, or SCS, is an innovative medical technique that has transformed the management of chronic neuropathic pain. Originally inspired by pacemaker technology and the gate control theory of pain, SCS involves implanting electrodes into the epidural space of the spinal cord. These electrodes deliver electrical pulses that modulate pain signals, offering relief to patients who have not responded to conventional treatment. Over the decades, SCS has evolved with advancements in device design and stimulation parameters, making it a cornerstone in the treatment of conditions like complex regional pain syndrome and failed back surgery syndrome. In this video, we'll explore the mechanisms, clinical applications, and future directions of SCS. Journey of spinal cord stimulation began in the 1960s when researchers first applied pacemaker technology to pain management. Early devices were simple, consisting of an electrode and a pulse generator. Over time, these systems have become more sophisticated with improved leads, remote pulse generators, and customizable stimulation programs. Today, SCS can deliver conventional tonic stimulation, high-frequency pulses, and even burst patterns, allowing for tailored pain relief. This evolution reflects decades of research and clinical experience, continually enhancing patient outcomes and expanding the indications for SCS. At the heart of SCS lies the gate control theory of pain, proposed in the 1960s. This theory suggests that activating low-threshold, non-painful nerve fibers can close the gate to pain signals in the spinal cord. By stimulating these fibers, SCS inhibits the transmission of nociceptive, or pain, signals to the brain. This foundational concept has guided the development of SCS technology and remains central to understanding how electrical stimulation can provide effective pain relief for many patients suffering from neuropathic pain. Spinal cord stimulation works by delivering electrical pulses to the dorsal columns of the spinal cord. These pulses modulate neural activity, reducing the perception of pain. Stimulation can be adjusted in terms of frequency, pulse width, and amplitude, allowing clinicians to customize therapy for each patient. SCS not only inhibits ascending pain signals, but also activates descending inhibitory pathways and influences brain regions involved in pain perception and emotion. This multi-level modulation is key to its effectiveness in treating chronic pain. Neuropathic pain is a complex and heterogeneous condition, affecting about 8% of adults worldwide. It can arise from damage to either the peripheral or central nervous system. Peripheral neuropathic pain is often seen in conditions like complex regional pain syndrome, failed back surgery syndrome, cancer, and diabetes. Central neuropathic pain, on the other hand, typically follows events such as stroke, spinal cord injury, or multiple sclerosis. Both types share features like spontaneous pain, allodynia, and hyperalgesia, but differ in their underlying mechanisms and treatment responses. Peripheral sensitization occurs when injury or inflammation in peripheral tissues leads to the release of mediators like cytokines and neurotrophic factors. These substances sensitize nociceptors, lowering their threshold for activation and causing even light touch to be perceived as painful. This process is central to the development of peripheral neuropathic pain, as it alters the normal function of sensory neurons and contributes to ongoing pain and hypersensitivity. Central sensitization refers to the increased excitability of neurons in the spinal cord and brain following persistent pain input. This phenomenon is driven by the release of neurotransmitters like glutamate and substance P, which activate receptors and enhance the responsiveness of pain pathways. Central sensitization is a hallmark of both peripheral and central neuropathic pain, leading to amplified pain responses and making treatment more challenging. Glial cells, including microglia and astrocytes, play a significant role in the development and maintenance of neuropathic pain. When activated by nerve injury, these cells release pro-inflammatory cytokines that further sensitize neurons and perpetuate pain. SCS has been shown to reduce glial activation, highlighting its potential not only to modulate neuronal activity, but also to influence the inflammatory environment within the spinal cord. One of the primary mechanisms of SCS-induced analgesia is segmental inhibition. By activating GABAergic inhibitory interneurons in the spinal cord, SCS increases the release of GABA, which suppresses the transmission of pain signals. This process, rooted in the gate control theory, is supported by both animal and clinical studies, demonstrating reduced excitability of pain-transmitting neurons after SCS treatment. Recent research has revealed that endocannabinoids and endogenous opioids are also involved in the pain-relieving effects of SCS. Activation of cannabinoid receptors and opioid receptors in the spinal cord contributes to long-lasting analgesia. These findings suggest that SCS not only modulates electrical activity, but also influences the chemical environment of the nervous system, enhancing its effectiveness for chronic pain. SCS also activates descending inhibitory pathways originating in the brainstem. These pathways release neurotransmitters like noradrenaline and serotonin, which suppress pain transmission in the spinal cord. Studies have shown that electrical stimulation of brainstem nuclei can inhibit the flow of pain signals, further supporting the role of descending control in SCS-induced analgesia. Beyond the spinal cord, SCS can influence higher brain centers involved in pain perception and emotion. Functional imaging studies have shown that SCS activates regions such as the thalamus, somatosensory cortex, insular cortex, and limbic system. This broad neuromodulatory effect helps explain why SCS can alleviate not only pain, but also associated symptoms like anxiety and depression. Spinal cord stimulation is primarily used for patients with refractory peripheral neuropathic pain, such as those with complex regional pain syndrome, failed back surgery syndrome, diabetic neuropathy, and postherpetic neuralgia. Clinical trials have demonstrated significant reductions in pain scores and improvements in quality of life for many patients. However, the effectiveness of SCS can vary depending on the underlying condition and individual patient factors. Patients with complex regional pain syndrome, SCS has shown remarkable results. Randomized trials report that over half of patients experience significant pain reduction when SCS is combined with physical therapy. This improvement is often accompanied by better function and reduced disability, making SCS a valuable option for those who have not found relief with other treatments. Back surgery syndrome is another major indication for SCS. Studies show that nearly half of FBSS patients achieve meaningful pain relief in the legs after SCS implantation, outperforming conventional medical management. Newer stimulation programs, such as high-frequency or burst stimulation, have further increased response rates, offering hope to patients with persistent back pain. For patients with painful diabetic neuropathy, SCS has demonstrated significant benefits. Clinical trials reveal that SCS can reduce pain scores during both day and night, outperforming standard medical treatments. These results highlight the versatility of SCS in addressing different types of neuropathic pain, especially when conventional therapies have failed. Osteopenic neuralgia, a chronic pain condition following shingles, can be particularly challenging to treat. SCS has provided long-term pain relief in many patients, with studies showing sustained benefits for more than 2 years in some cases. This makes SCS an important option for individuals suffering from persistent neuropathic pain after viral infections. Central neuropathic pain, often resulting from spinal cord injury, stroke, or multiple sclerosis, presents unique challenges. While SCS is not yet widely approved for central pain, case studies and preclinical research suggest it may offer significant relief, especially when applied early after injury. Ongoing research aims to better understand the mechanisms and optimize SCS protocols for these patients. Timing of SCS initiation can influence its effectiveness. Studies indicate that starting SCS soon after nerve injury increases the number of responders and prolongs the duration of pain relief. Early intervention may help prevent the establishment of chronic pain pathways, underscoring the importance of timely treatment decisions in neuropathic pain management. As with any invasive procedure, SCS carries risks. Device-related complications include infection, lead migration, and hardware malfunction. Some patients may experience discomfort from the implanted pulse generator or even rare complications like spinal compression or hematoma. Careful patient selection and close monitoring are essential to minimize these risks and ensure the best possible outcomes. Maximize the chances of success and minimize unnecessary procedures. Most patients undergo a trial period with temporary SCS leads before permanent implantation. This allows clinicians to assess the patient's response to stimulation and determine whether long-term therapy is likely to be beneficial. Only those who experience significant pain relief proceed to permanent device placement. Beyond physical pain relief, SCS has been shown to improve psychosocial outcomes. Patients often report reduced anxiety, depression, and disability after successful SCS therapy. By addressing both the sensory and emotional aspects of pain, SCS contributes to a better overall quality of life for individuals living with chronic neuropathic pain. Despite its benefits, SCS is not effective for everyone. About 2/3 of patients with certain conditions such as CRPS may not respond to SCS. Factors influencing response include the underlying cause of pain, duration of symptoms, and individual differences in pain processing. Ongoing research seeks to identify predictors of success and refine patient selection criteria. Professional organizations offer varying recommendations for SCS use. The European Federation of Neurological Societies and the International Association for the Study of Pain provide weak recommendations for SCS and CRPS and FBSS, while the National Institute for Health and Care Excellence in the UK supports its use for chronic neuropathic and ischemic pain. These guidelines reflect the evolving evidence base and the need for individualized treatment decisions. Future of spinal cord stimulation is promising, with ongoing research focused on understanding its mechanisms, optimizing stimulation parameters, and expanding its indications. Advances in device technology, such as closed-loop systems and wireless implants, may further improve outcomes and reduce complications. Continued collaboration between clinicians, researchers, and patients will drive innovation in this field. Selecting the right patients for SCS is crucial for success. Ideal candidates are those with well-defined neuropathic pain syndromes who have not responded to conservative treatments. Psychological evaluation and multidisciplinary assessment help ensure that patients are prepared for the demands of SCS therapy and have realistic expectations about outcomes. Effective management of neuropathic pain with SCS often requires a multidisciplinary approach. Collaboration among pain specialists, neurologists, psychologists, and rehabilitation professionals ensures comprehensive care. This team-based strategy addresses the physical, emotional, and social dimensions of chronic pain, maximizing the benefits of SCS therapy. Educating patients about the risks, benefits, and expectations of SCS is essential. Clear communication helps patients make informed decisions and prepares them for the trial and implantation process. Ongoing support and education after implantation can improve adherence to therapy and enhance long-term outcomes. For many patients, the greatest benefit of SCS is the improvement in quality of life. Reduced pain, better sleep, increased activity, and enhanced mood all contribute to a more fulfilling daily experience. By addressing both the physical and psychological aspects of chronic pain, SCS offers hope to those who have struggled for years with intractable symptoms. Summary: spinal cord stimulation represents a major advance in the treatment of neuropathic pain. While not a cure, it offers meaningful relief for many patients who have exhausted other options. As research continues to uncover the mechanisms and refine the technology, SCS is poised to play an even greater role in pain management. For those living with chronic neuropathic pain, SCS provides not just symptom relief, but a pathway to improved function and well-being.